Hello everyone. Today I'm going to talk about assessing children's risk for dental caries and parental preventative practices. Definition. The Caries Risk Assessment Tool is a research-based tool used to identify the risk factors that cause dental decay. It is also used to provide recommendations to reduce the risk of the future cavities. It has been well documented that dental decay affects children throughout their childhood and into their early adulthood. Applications in odontology. In odontology, the applications are prophylaxis, fluoride treatment, and teach the correct use of dental hygiene elements such as toothbrush, dental floss, and mouthwash. Okay, pros and cons. Pros: avoids the appearance of cavities, avoids bad breath, avoids gingivitis, avoids bacterial plaque, dental calculus, and tartar. And there's no cons. Issue applied in Ecuador. A study of 2018 in Ecuador, preliminary data show that about 80% of the mothers or primary caregivers had active decay in the past year and did not have a dental home. Almost half of the children had not seen a dentist within the last year, and some of them had never seen a dentist until the encounter with this study. In conclusion, going to the dentist at an early age for treatments and an early knowledge and practice done also by the parents with instructions of the dentist helps reducing the risk of cavities in the children.
There's a hot topic in dentistry, and it's called Cambria. And everybody gets confused what exactly that is when you're trying to implement it within a practice. Cambria is caries management by risk assessment. And so what does that mean? What does that mean for the team, and what does that mean for the practice? Well, one of the things that I would like to suggest is that you look at different products that you can bring within your practice to start changing the way that the practice is taking care of your patients. Stop the drill and fill effect and make that paradigm shift and start looking at prevention. When you look at prevention, you're going to grow your practice in many ways. And there's so many times when we don't have the idea that if we stop drilling and filling, that all of a sudden the practice is going to dry up and everything is going to go away. We need to have that abundance mentality. The abundance mentality means that if you can actually treat caries, get them all healthy, and then stop them from getting any more, you're going to have so many happy patients that they're going to tell so many other people about you. Stop the concept and the idea of thinking that, well, if I show them how to get healthy and keep them healthy, that nobody's going to need any dentistry. There are millions of people out there with horrible oral care, and they're in need of your help. And if we can get our patients healthy and get a plan for getting them healthy, it is going to grow your practice in big ways. One of the ways that you can do that is establishing products that you can bring into the office. Not only establishing products that you can bring into the office, but implementing a plan. Hygienists are amazing, extraordinary auxiliary on your team. They're not only producers that are going to help with prevention of patients, but they have great concepts and ideas and abilities to be able to implement those products within your practice. And sending those patients home and following up with those patients is really another key to the success. patients won't have long-term success unless we talk to them about it continually. A lot of times patients need to hear something 5 or 6 times before they actually really take what we're talking about seriously.
Topic: tooth decay. What causes cavities?
A black sketch pen.
Nah. Our mouth contains billions of bacteria which live on our teeth, tongue, etc. Most of these bacteria are usually harmless.
Just like me, right?
Yeah. Now listen. A tooth consists of enamel, dentin, and pulp. Enamel is mostly made up of minerals. Dentin is a layer underlying the enamel, whereas pulp has blood vessels and nerves. Now, when we eat foods containing sugars, some of these bacteria feed on the sugars producing acid. This acid starts to dissolve the minerals of the tooth enamel, causing tooth decay. Usually, our saliva restores these minerals, thus preventing further decay. But if we continuously eat sugary foods, then our saliva cannot keep up, causing the bacteria to pass into the dentin and then eventually into the pulp, thus creating cavities.